Sam, Uganda went into lockdown in June to battle the third wave of COVID. What is the situation like for the communities at the moment?
Wow, I'm not sure where to start from, but remember we had just come from a tough lockdown and it had been eased a bit. So life was beginning to get back to normal, and then boom, we are slapped into another lockdown. So what I could say briefly right now, when you look at people's faces, you see stress, you see depression, joblessness, unemployment, you see poverty, and of course, where there is poverty, there will also be death, because we have corona cases have been surging, and obviously we have a mixture of free healthcare and then private healthcare as well, where you have to pay. We are challenged that where it is free, the services are not good, and it's basically in the perception and in the minds of all the people. They are scared of going to government hospitals because they know they will not be attended to. And then when it comes to private hospitals, they are enormously expensive. So as I wind up, I want to say there is poverty, but also we can tell that there is going to be more death in our communities. It's not gonna be a good situation. We just have to pray to God to intervene. But also, as I wind up on that question, I want to say that you can still see hope in the lives of these people. One reason is because we are there as an organization. We are trying to do what we can do, but also, on the other hand, they know that also possibly this will be over at some point, though they are not sure whether they will live to see it getting to an end. That's the situation we are in.
Great, thanks, Sam. And you said that Kids Club Kampala is doing what we can do. I suppose it would be great to hear what Kids Club Kampala is doing and what you're able to do in the slums and the communities that we're working in at the moment.
Thank you, Linda. Yes, we had to turn well, first of all, we learned from the previous lockdown. If I can refresh our minds again, in the previous lockdown, we had to turn our education centers into food banks. We had to adjust on most of our programs and do homeschooling, provide school materials for the children to study from home. So this time around, it was very easy to adjust quickly into going back into that program. So yes, our food banks are running during this time. We have so far provided 4,243 people with food in just a period of 1 month. And also, I think it's been communicated worldwide that there's lots of domestic abuse, violence against children increasing worldwide. And now when it comes to countries like Uganda, among the poorest countries, all the people's frustrations, anger is always passed on to the children and the wives in most cases. So cases of violence against children are on the rise, especially in the slum community. So we are responding towards this. We have our safeguarding officers alert. The good thing is that we are community-led and community-driven. So in most of the communities where we work, we already have safeguarding officers there and volunteers trained. So they can respond to all these emergencies within their communities, reporting to us at the head office. Then with coordination, we work with the police and they see that we rescue these children. So in just a period of about 1 month, we have worked on 44 cases to just rescue children. And it's absurd because among the cases, you have children with broken arms by their own parents. You have children being raped by their neighbors. You have children being denied food, even when the parents can afford food because they want to appease their gods. It's very unfortunate that we still believe in these other small gods. So the situation is not really good, but at the end of the day, there is hope because we are there. And of course, with the support of you, our friends, our families, so I also want to thank you for standing with us. So also, our rehabilitation program is still continuing. Some of these children we have rescued. We have managed to take them to the home. We are rehabilitating 51 kids right now at the home. We are still being called for more kids. The unfortunate bit is that we had run out of space because it's a tricky time. There is COVID. You don't want to risk to bring in a child with COVID and again infect the rest of the children in the home. But again, we are there to help provide rehabilitation services. And so we have been accepting more children to come. And of course, working on also having more space so that we have enough space for accommodating all these children. So that program is continuing. Our homeschooling is still providing materials to over 100 children, the slum communities, and our teachers keep visiting these children. And then the other children will bring their books to the teachers at the center to look through, mark, and then give more assignments. It's proven to work best because there is a more bigger personal touch between the teachers and the children. It's worked out well, and well, we are good. We are really happy that we thought that way. Also, our knitting and the skilling project has continued during this time. We had to discuss with the authorities to see how we could help because these young mothers did not want to stay home doing nothing, and yet they had begun on the skilling project. So most of them were like crying to us, we just don't want to stay home under this lockdown. And so we worked out with the authorities and they allowed us to have minimum numbers. So we have a class of about 5 people, and then we rotate. We have about 3 shifts or 4 in a day. But our skilling projects are also continuing, of course, with observing the standard operating procedures, making sure everybody is safe, is washing their hands, they have their masks on, and keeping safe distances. So we are doing everything we can to help the communities. Although I must warn you, the need is enormous. It's like you just can't exhaust the need in the communities. And of course, this alone in Kampala, but even out there, we are well aware that in other country towns, districts, in the refugee communities, the situation is alarming. Thank you.
Thanks, Sam, for that. And what will the long-term effects be of the lockdown for the communities?
Whoa, lots of unemployment, of course, poverty, of course, crime will be on the increase, and we of course anticipate more death from poverty itself, because poverty itself kills. You want to go to the hospital, but you do not have the money to pay for the services. So the situation is going to be alarming.
Thanks, Sam. And I'll just ask you one more question, and then I'll open it to our friends here. I suppose it is a really tough situation, and we know a little bit about it here because we've all experienced lockdown. But how are the staff and the volunteers faring? Because it's a really tough time for them to be working, but also to be worried about their families, to be worried about themselves. So how are the staff and the volunteers?
Well, we have continued to do our rehabilitation program with the staff. Obviously, these are conditions we are used to. So our more of our counseling and prayer sessions are still continuing, even though they are in distant places. We can still, we are in touch with one another, speaking to one another to find out what's happening to them, ensuring that everybody is doing okay. Besides that, we are still providing enough facilitation. People can still get their salaries regardless of the situation we are in. They can afford a meal, they can afford the accommodation. But also on the other hand, we are providing sanitary, whatever is required, basically sanitizers for them in the communities. We are providing the masks. We are ensuring that they are okay. We are doing our best to make sure that everybody is fine wherever they are. And indeed, nobody has had COVID apart from myself, obviously, who is always taking the best care of himself. But it's it's me, and unfortunate, but everybody has been fine. Both all the volunteers in the communities, the staff, everybody has been fine. We are trying to do our best. All the centers are stocked with enough water, soap, sanitizers, spacing. We are trying to really follow the standard operating procedures. Also praying that we will have vaccines soon, enough for everybody in Uganda.
Thanks, Sam. And just maybe just to share with you before I open it to the floor that we're doing all we can here in the UK to raise more funds for the work that we're doing in Uganda. And I know many of you have been part of, we have two different activities on at the moment. We have Miles in Their Shoes, and I see Martina here and a few others and ourselves who are doing it as well. And to date, we've raised £2,846 for Miles in Their Shoes, which is great. We still have that activity and won't end until we reach you in Kampala, Sam, which will probably be the end of August, September for some of us, and maybe we'll never get there for others, to be honest with you. But we hope we will get there soon. So that's been great, and thank you to all those involved in Miles in Their Shoes. And then we've also launched Serving Communities in Crisis Appeal, which is our emergency appeal at the moment. And thanks to everybody who has already donated to that, and we have raised £1,396 for that, so that's fantastic as well. But we will continue. Obviously, Miles in Their Shoes will definitely continue, and our appeal will continue for some time as well, because we appreciate all the fantastic work that the team are doing in Uganda, and want to raise the funds for you to be able to continue that, because it's a long journey. The journey's only beginning now. People are in a very difficult situation, but it will take a long time for people to rebuild their lives and their livelihoods, and we're here to help the team in Uganda do that. So that's just a brief snapshot from Sam as to what they're doing, where they're at, and how they are, which is the most important thing, keeping safe and well. So I just want to say a big thank you to our supporters who are always there. You're always there. Anything we ask you, you're just so loyal and fantastic, and that's the foundation we're built on, is the foundation of our supporters and our friends and family who are the Kids Club Kampala. So thanks again for all the work that you do for us, that all the support that you give us. And also I just want to say a big thank you to the team here in the UK. Jess, Joe, Andy and Corey doing a fantastic job as well, to keep us all moving, which is fantastic, even in this hot environment we're in at the moment. So thanks to the team here. But a big, huge thanks to Sam and the team in Uganda for being able to deliver what you are in such really challenging and difficult circumstances. It's incredible and amazing, and we're very grateful to you and the team. And please pass on our thanks to everybody for risking their for doing the work, but also risking things as well. And but it's about keeping everybody safe and doing everything we can to support the communities we work with. So thanks, Sam and the team here in the UK as well.
Thank you. Thank you, Linda, for the kind words. Very encouraging. And thank you for being a wonderful leader, obviously. Thank you, our supporters. So glad to see you. As always, you have been there every time we are calling upon you. You're always there, always supporting us, always encouraging us, always pushing us to work so hard. You know, sometimes it looks like it's us who are doing a lot of work, and then we forget that actually we have you guys who are always pushing us, and you're like, Sam, go, keep going, keep going. So so amazing to have you guys to be part of this initiative. Thank you very much.